last year, India overtook China to become the most populated country in the world. With its vast population and its geographical, social and economic diversity, how does one ensure that every citizen has access to a fundamental right, the right to quality healthcare? This is an opportunity to define the India Health Mission and what shape it should take. How do we democratize healthcare in India? What are the health challenges for an India grappling with an ever-growing burden of disease that is no doubt impacting its demographic dividend? How should our health system respond to the next big health emergency of our times, climate change? These are the questions we seek to answer in setting the agenda for India Health Mission. And to help answer all these questions, we are joined by Dr. Sunila Garg, Chair Program Advisory Committee, National Institute of Health and Family Welfare. In fact, it's the policy think tank of the Government of India. She's also the Public Health Expert Advisor, ICMR. Joining us also is Dr. Soumya Swaminathan, Principal Advisor, Ministry of Health and Family Welfare, Dr. Raman Gangakhetkar, Padma Shri Awardee, Public Health Expert and Epidemiologist, Head Scientist of Epidemiology and Communicable Diseases, ICMR, and Dr. K. Madan Gopal, Advisor, National Health System Resource Centre, Ministry of Health and Family Welfare, Government of India. Thank you all so much for joining us on this very critical conversation and to set the agenda. To begin with, Dr. Swaminathan, I would like to ask you the first question. This really is an opportunity to define the India Health Mission and what shape it should take. How would you like to outline its agenda?
Thank you very much for bringing this important topic to the viewers, because health always comes up, whenever there's a crisis or a catastrophe, then we see the headlines. And then what we see are these cycles of panic and neglect. So what we really need to see now is a very consistent and sustained investment in health. And it has been shown repeatedly by economists that if your health improves, then the GDP also improves. So I think one route to our economic progress must be through having a healthy population. And of course, the other arm is having a well-educated and a well-skilled population. So essentially, we're investing in our human capital. So at the outset, I think whatever is spent on health should be seen as an investment and not as a cost. So it should not come under the regular cost centers of government, but really this is investment for the future. Now, having said that, our national health policy, I think if you really look at it, it's quite a visionary policy. And it laid out the roadmap for where India needs to go. And of course, as we know, the goal of any health policy and any health mission is the attainment of the highest standards of health and well-being, physical, mental, and spiritual. And that is attained through a universal health coverage.
Absolutely. Thank you for setting that really well and explaining it to us really well. Dr. Sunila Garg, like, Dr. Swaminathan just said, we have the funds, but a lot more needs to be done. Investment is needed. Now, we know the challenges as a country that we are grappling with, whether it's overcrowding in hospitals, whether it's lack of trained manpower. I mean, the list goes on. How to last mile accessibility. We do know the challenges. If I can ask you here, as a country, will we ever reach a situation where everybody will have access to good healthcare? And how far are we actually from achieving this goal?
Thank you, Ambika, for having me on the show, and that too in the studio. I think it's a very important question that first of all, whether we will be ever able to have universal access to healthcare, and that to respectful access to healthcare and according to gender as well. I'll say India has done fairly well in terms of when we look at our important indicators. Our maternal mortality is now 97 per 100,000 live births. Our infant mortality has come down to about 25.6 per 1,000 live births, and like that way we have made very good progress in terms of our indicators. But more important is also what we have to realize. Today 1,72,000 health and wellness centers we have made operational, and another by 2030 we are going to make almost 50% of our 30,000 primary health centers, which are going to be functional 24/7, so that particularly when we are talking of vulnerable periods, especially when women are in the during the process of delivery and all, and during emergencies they can seek care. But also we have to address the regional divides, whether we are talking of rural areas, urban areas, whether we are talking of tribal areas, and according to gender also we have to see that whether when we look at our own data sets, we need to look at very carefully that, particularly from gender perspective, how are we doing? But important at this point is, when we look at out-of-pocket expenditure, it is, though, come down, but it's still around, I'll say 60%. That is important, and that's where is the role of private-public partnerships.
Yes.
Some states like Tamil Nadu have already demonstrated, about public-private partnership, but we need to go much more in that direction. And also, I will say that there is role of professional associations, and we need to address the issue as a whole, and we need to look at human being as a whole, not from the disease perspective. So this is, we do have, long mile to go, but we will make it.
So progress has happened, looking at positively, but yes, we do have a long way to go. Dr. Gopal, I would like to come to you here and ask you, now India is a leader in the global pharmaceutical industry, that talent, pool and also the cost advantage. How do we make it work across a wider healthcare spectrum within India?
It's good that you have asked this question, because we claim that we are the pharmacy of the world. We have been able to demonstrate ourselves during the COVID and the tiring times. We have been able to provide support to many of other countries, but still a lot of challenges are there. We have to remember that still a lot of potential is there. The potential is untapped. If you look at the potential which exists, so we are still we are still grappling with the issue of creating API, that is active pharmaceutical ingredients, so that we become self-sufficient in the production of the drugs. That's one thing. And if you look at the devices, more than 80% of the devices, they are imported. So we are still a lot of work to do on the device front. Okay. And the third is in the diagnostics also, we have grappling with the issue, how to create more indigenous diagnostics so that we can improve the access to the diagnostics and the free drugs. Though we have a free drugs and diagnostic initiative in the government of India is supporting that. But recently we have launched the Indian Public Health Standards, wherein the facilities, I've spoken about 2 lakh plus facilities, they have started doing the self-assessment. Second thing, we have created a talent pool through diapers, and we are trying to see that how the academia and the industries, they partner together and create a product which is used by the Indian customers as well as the Indian population. And that will definitely, my previous 2 panelists, they have spoken about out-of-pocket expenses. But this is one of the major initiatives which would be making a dent on out-of-pocket expenses.
Yes.
We are trying to see that how the dependency on APIs, the imported APIs is reduced. We are trying to become Atmanirbhar in our APIs. After the APIs, we are trying to see that how the generic medicines are reached to the access to generic medicine is made available to the nook and corner of the country.
No, yeah, thank you so much, Dr. Gopal. Dr. Gar, before I go to Dr. Raman, I want to just quickly ask you, since we have spoken about the challenges, Dr. Gopal just got that. What are the 5 biggest, health challenges or emerging health challenges as we Indians are facing right now, and which should be addressed immediately? I would like to add that as well.
See, number one, I'll say that the deficiency of human resources, that is one point. And then, as I said, we are in the transitioning phase. We haven't gone out of, non-communicable communicable diseases like HIV, TB, malaria, though there is a call for elimination of TB by 2025, but that's a major challenge. And also, neglected tropical diseases. But then we also have a burden of non-communicable diseases as well. So that is important part which we need to remember. And our infrastructure facilities also need to be, up to the mark.
Thank you for putting that forward. You spoke about the initiatives, and Dr. Ganga Khetkar, thank you for speaking with us. My question to you here is, India's biggest healthcare campaigns and missions, do they need reimagining and redesigning in the face of these emergent health challenges, whether it's Indradhanush or Polio Mukt Abhiyan, for example?
The approaches that you are talking of, whether we should have an intensified approach to one, has its own benefits as well as issues surrounding. One of the bigger challenges to my mind today, which we have to handle, is we are currently going by vertical programs for diseases where the burden is high or the mortality rates are high or morbidity is equally high. But what is most important if you want to actually make a difference? You should ideally ensure that there is decentralization as an approach which starts working in the state. Now, in order to do this, no, if you ask me, I would definitely say that we know enough about different diseases, but we have to ask a question to ourselves: have I implemented them well? No, therefore, implementation science research, implementation related issues to be handled become suddenly important. And if you want to handle these implementation related issues, there are two angles which I will have to keep. No, if I believe in decentralization, you will have to train the state governments to understand the evidence that is presented before them and then try to devise different policies and test them. Otherwise, you will find that they will not be able to make a major difference. So there are two angles, as I said. Centrally we are running very well. There is no doubt on that part. Our strategies are extremely good. But when it comes to implementation, ensuring that decentralization occurs and community is mobilized would remain a major priority for a country like ours.
In fact, thank you for setting the context. For the next question, Dr. Gopal, we've just spoken about implementation and community. So obviously the government by itself cannot possibly achieve this huge task. What innovative public-private partnership models can help in extending healthcare to across geographies, communities, genders, as well as economic status?
Thank you. If you look at the various public-private partnerships, one of the biggest thing which comes to my mind is the PMJ program. Is a partnership between the government and the private providers in providing care to 50 crore population. That's one of the biggest examples. And the scheme administration has been simplified by the pre-designed and pre-approved package rates. That's one thing. And it is going strong and strong. And many of the states, they are implementing the models in a different form, one form or other form. It is gender neutral, and I think all people can access who are eligible for this. The second example which is coming is we have been providing emergency medical response initiatives. Under that, we are providing the BLS ambulances and the ALS ambulances. It is on a partnership mode. So, other example is the mobile medical units which are there, so which we are trying to reach. All the three questions which you have asked, the gender and the other thing, access, and that has been taken care by this.
Yeah, actually, you're absolutely right, Dr. Gopal. Sorry, for just coming in here, you're right. We have so many examples. It's about making them work together. I think what you rightly said. Dr. Swaminathan, what key policy reforms or innovative approaches are essential to create a more sustainable, inclusive and equitable healthcare system in India, ensuring access to quality healthcare for all citizens?
Thank you very much. I'll add to what the previous panelists have been talking, and we've been talking about our Ayushman Bharat program, which has essentially two arms. One arm is the primary health care delivery through our primary health centers and health and wellness centers, which are manned by these community health officers. And then there's upward and downward linkages that are supposed to happen there, to the district hospitals and the tertiary hospitals to provide a comprehensive primary health care. The other element is the PMJY, which is the insurance coverage, for the poorest 40% of the population, so that we prevent catastrophic out-of-pocket expenditure. And that's only for hospitalization. Community engagement is absolutely critical. And I think there's still a big gap in most states of India in terms of community engagement in health. People are not aware of, of what keeps them healthy and what services are available and when they should seek. So if you look at just common things like high blood pressure and diabetes, the majority of people who suffer from high blood pressure and diabetes are unaware. They've never had a checkup. Yes. Then they don't know they're supposed to, and therefore they end up in the hospital only when they get a complication.
Yes.
So the role of our primary healthcare system is to prevent disease as far as possible, or prevent progression of disease, and promote good health, which means also attention to public health, air pollution, clean water, sanitation, nutrition. These are the things which keep us healthy, not medicines. You see, you need medicines and diagnostics when you fall sick, but our goal should be to stay healthy. So this is why I'm saying that we have to reimagine the way we're delivering it. I think a lot of it is actually there in the National Health Policy of 2017. If you read it, there's also scope for digital. And I think this is where the policy levers can come in. There should be enough space for innovation and learning from each other. And eventually what we would like is tech-enabled healthcare workers. We're not going to replace the healthcare worker ever.
Yes.
But if they are tech-enabled, then they can do their job, much better. And ultimately, we should be measuring health outcomes. So any new innovation or experimentation we put into the system,
Yes,
does it or does it not improve health outcomes? And then we can scale it up.
Absolutely. I think measuring health outcomes is critical. So on that note, we're going to be taking a very short break. When we come back, we'll look at more solutions that how we can make India truly healthy. So please stay tuned. Welcome. You're watching a special show, India Health Mission, and Dr. Ganga Khedkar, I would like to ask you here, the Ayushman Bharat insurance scheme is now covering senior citizens over 70 years as an aging population. What kind of impact will this have on public health care?
It would have immense impact, there is no doubt. One thing which we have to recognize, more often than not, in these age groups, the illnesses that occur perhaps are going to have a community response that these old people will stay at home and whatever care can be provided to them will perhaps be provided, because you will have to have some people who will accompany some of his relatives or her relatives accompany to the hospital. That becomes a major challenge. Now, which would essentially mean we will have to have different levels of healthcare available at different levels, at the care that has to be provided to them has to be different at different healthcare level.
Yes.
Because then you will be able to ensure that hospitals are not loaded with these kinds of patients. But I completely agree, 70 plus people on whom the family may or may not be willing to spend so much of money, if they receive this insurance, if this coverage is available, it's going to make a major difference. But most important is all these people should come to know of this particular scheme, and
Yes.
that should be one of the most important issue which the government will have to handle everywhere.
Yeah, thank you for explaining that so well. Dr. Gopal, I'm quickly going to ask you, all of you, one last question each. Talking of non-communicable lifestyle disease, responsibility for good health also should be in the hands of the citizens. We've been talking about that. Now, how do we make good health looking, after oneself, whether it's eating right, like all of you've mentioned? How do we make this nationwide movement a Jan Andolan, much like the Swachh Bharat mission, which has saved the lives of 60,000 to 70,000 infants per year, this recent report which has just come out?
Definitely, because Jan Andolan is a key for addressing the social determinants of health. What you are saying, because we have focused more on the disease part. From the disease, we have moved towards the health part. From health, we have moved to wellness, and from wellness, well-being. So now for well-being, you have to address the social determinants. And for addressing the social determinants, we require movements like Swachhata Bharat Mission, Eat India, Fit India movement, the Eat Right movement, and other movements also.
Absolutely. I think everybody has to do this together to truly make our country, healthy. Dr. Swaminathan, I think this question is very critical. Before we actually end, this is important. What are the health risks posed by climate change, and how can we work to mitigate that impact?
So I think, after pandemics, I think pandemics will come once in a blue moon, hopefully. But climate change is here to stay and is impacting us today. So I think the biggest threat to our health today is climate change in different forms. Now, of course, the impacts of climate change can be direct, like, for example, heat wave we saw this year and previous year also, the hottest years on record so far, with the longest period of prolonged heat exceeding all the previous limits. And we saw higher mortality during these months, the summer months, and also a lot of morbidity. You can't really work, you can't be productive when you're under, so much of heat, particularly if you have an occupation where you have to work outdoors, you have to do hard physical labor. So I think that is probably the one biggest health risk today due to climate. Then, of course, floods leads to, displacement, children out of school, families getting disrupted, more migration happens because of prolonged droughts in some places they are not able to do agriculture anymore. Many vector-borne diseases, we've seen dengue this time, chikungunya, and diseases like that really increasing, even in places which they did not survive before. Our first goal is to protect the most vulnerable, because that is, the basic principle of equity that we apply in our particularly in health. It's very important to apply the equity lens. And therefore, I think that decentralized approach, give them the resources, but also make them accountable and responsible, and provide the capacity and the tools because climate is something unpredictable. And we're all learning, we're changing
We're
all the
living
time.
it actually.
So
Yeah,
while
we're
there will
seeing it,
be,
we're witnessing it.
yes,
Yes, without wasting any time, Dr. Ganga Khetkar, just a last question to you. I want to ask about, about strengthening disease surveillance and early detection, system. A little bit on that, please.
No, it is essential that new and newer zoonotic infections may come. So we need to have an extremely good surveillance.
Yes.
So to my mind, today One Health related approaches where we say that when it comes to surveillance, surveillance should not be only among human beings, but it has to be among all parameters that are associated with zoonotic transmission becomes important. We have taken major steps, and I hopefully perhaps they will be so matured that we will be able to detect early and try to ensure that the response with drugs or vaccines will come quickly, because we would create a mass of people or industries who would have rapid drug or rapid vaccine development programs in place, and that would be essentially good.
Yeah, so I think prevention, and lastly, Dr. Garg, I would like to ask you, we've spoken, all of you have explained it so well, I think for us, the viewers. I want to ask you, in your view, if you were responsible for allocating the health budget of India, how would you allocate that? What would you do? How would you use the funds?
See, I'll first think that we have got resilient, high quality healthcare system which have got accessibility till the last mile. So for that, not only strengthening of the healthcare system in a holistic manner, that's very important. We have to, spend on human resources, we have to spend on the systems, we have to spend as per Indian public health standards, but community involvement is key. So we need not shirk from information, education and communication. Unless, our community is well informed, we cannot do anything.
I think very well put. Each and every citizen is very precious. Thank you so much, Dr. Garg. Thank you so much, Dr. Swaminathan. Thank you so much, Dr. Gopal and Dr. Raman for joining us today. India is a relatively young country, but it is also a country with a number of significant health concerns. If we want a demographic dividend to work for us in creating a healthy, productive population that contributes to the prosperity of India, it is imperative that we come together to work on providing accessible, affordable, quality healthcare, never forgetting that good health starts with us. This is India Health Mission. Let's make it a people's movement.